Hello there, it's Ryan Liberty. In this video, I'm going to answer the question, what is reactive attachment disorder? Let's find out.
Ooh, ah.
Alright, let's get to what reactive attachment disorder, also known as RAD, is. Before I get to that, though, I just have to say that this is not diagnostic criteria. This is not the stuff you should be using to diagnose anybody. In any way, a trained professional should be the one who's doing that. This is just a description of what this reactive attachment disorder looks like, so you can recognize the pattern if it's in your life or the life of a loved one. And if the label of reactive attachment disorder for any reason doesn't jive with you, if it doesn't make you feel good, then you don't have to use the label, you can let it go. This is really just to point you towards what's going on, what may be going on in your life. So with that said, let's get into what reactive attachment disorder is, RAD. So I've got my notes because I always want to make sure I'm giving you good information here. And reactive attachment disorder is something that's characterized in children, and it's an emotional withdrawal towards a caregiver. So there's a minimal seeking of comfort, and when they get the child gets comfort, it doesn't do very much for them. They don't feel comforted. So there's also, along with that, a social and emotional disturbance, and that can show up as having poor response to other people's emotions, or poor, like I just said, if somebody comforts you, then it doesn't comfort you. There's just no connection with emotion. There's limited positive emotions in these children, so they're not so quick to express joy and happiness and love and all of those kinds of things. And they have moments of unexplained irritability, sadness, and fearfulness, even during non-threatening encounters with an adult caregiver, because this really revolves around reaction to a caregiver primarily. So when they're with the caregiver, they don't have the emotional expressiveness, and apparently even they just have moments of being irritable, sad, or fearful, even when the environment is completely safe and there's no obvious reason to feel that way. It just kind of happens. So along with this, there's patterns of insufficient care in their life. So they're socially neglected. They're not getting their emotional needs met. They're not getting the comfort they need, the stimulation, or the affection that every child needs. There's typically a repeated change in caregiver, say in foster care. We're moving from one caregiver to another with not enough time to attach to that caregiver, or there's an environment that doesn't foster the ability to attach to a primary caregiver. So if you're in a home and you're being cared for by multiple people, but there's no primary person in charge of taking care of you, then the child doesn't form the natural attachment that happens in childhood. Now, this is not autism spectrum disorder. That's just something to be aware of. And it's something that happens, those insufficient means of care are what lead to the child withdrawing and not attaching and not having that emotional affection that every child normally has. This is something that is evident before age of 5, and the child has to be at least 9 months of age before you can start seeing this. If it's something that's been going on for 12 months or more, it's considered persistent. And if all of these symptoms, the lack of emotional responsiveness, the limited positive emotions, irritability, sadness, and fearfulness that kind of comes out of nowhere, if all of these, and all the social neglect and the lack of caregivers, if all of this shows up at high levels, then it's considered severe RAD. The good news is that there's treatment, and the treatment typically revolves around the caregivers. So the first thing you do is try to get the environment stable and get one primary caregiver in place to take care of the child, and then that caregiver you educate that caregiver on good parenting skills and how to take care of the child and meet their emotional and social needs. Also, an option, depending on how this expresses itself, is medication. not necessarily needed, but it can be used to help other things that may be going along with RAD. So all of that said, what does it feel like for the kid that's experiencing reactive attachment disorder? So inside the body, they're probably feeling anxiety, which they can't calm down, because remember, they don't have that emotional connection with people. So when somebody goes to comfort them, they're not comforted. So that anxiety just kind of plays out. It just exists. And they may feel maybe a little bit of depersonalization as a result of that not feeling connected. They may not feel connected to their own body, like it's their own. As far as what's going on in their head, this is a traumatic and stressor disorder, trauma and stressor disorder. So they probably have trouble connecting their thoughts together, a little bit of trouble with a sense of time. So they don't really realize how much time has passed. Emotionally, they're very uncomfortable because they can't be soothed. They lack positive emotions. They have those moments of anger, irritability, sadness, and fear that just kind of spring out of nowhere. Because they're not able to connect and have that social engagement, they lack remorse for a lot of their actions. And also because they don't, again, with their emotions are kind of a little bit all over the place, they may not be able to recognize their own emotions and what's going on, so they may have a little bit of alexithymia. Behaviorally, they tend to withdraw from adults and caregivers, and they want to stay isolated to themselves, but they also may seek comfort and not get the comfort they need. They may act out and try to get comfort, but they're not going to be able to receive it. But they will try to get it. Even though they're withdrawing from adults, they'll still try to get comfort in some way from adults. And because they're not able to be comforted, another behavior that you may see is that they just won't be able to calm down no matter what you seem to do for them. So that's just a quick little brief overview of what reactive attachment, also known as RAD, is. I hope that's helped you if this is something that you suspect that a loved one is going through. And if you have any questions or comments, please leave them below. I appreciate that you wanted to get to know about this today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below, because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.